Healthcare is changing, and Dr. Nancy RN is here for you. The topics are many, but each program stands on its own with 3 key action points for you to learn. Your guide to a healthier you in a changing world. Dr. Nancy RN.
Welcome to Dr. Nancy RN. Healthy world, healthy nation, healthy you. I'm Nancy Valentine, PhD and registered nurse. And this show is dedicated to you, the healthcare consumer. And our show today is for those that have heart disease. So our title is, Got Heart Disease? Eat Without Salt? Are you crazy? Now, we've all known people that have had this problem, and we're going to talk to you today about what constitutes heart disease, what are some of the signs and symptoms, and then really get down to this whole issue around diet, particularly around salt. And we have a very experienced nurse researcher, an exemplary person who's made a big effort in this area to really help you, the consumer, deal more effectively with your health. So let me introduce you to Dr. Barbara Riegel. Barbara Riegel is Professor of Nursing and the Edith Clemmer Steinbright Chair of Gerontology at the University of Pennsylvania School of Nursing. She also is the director of their Biobehavioral Research Center, which is dedicated to advancing knowledge about the interaction of biological and behavioral health factors in the promotion of health. And she's going to tell us about what they do. She is an established nurse scientist, and her area of focus is really studying adults, particularly older adults with cardiovascular disease. So her area of expertise is self-care and really helping you to work on your self-care, particularly if you have heart disease. So the 3 key points that we're going to talk about today is, why do I need to avoid salt? Where is salt hidden? So we're going to turn you into a salt detective. And then we're going to talk about ways to limit, perhaps not eliminate, but eliminate salt and still enjoy your life. So Barbara, thank you so much again for being with us. This is the beginning of a series on heart failure and heart disease, which we hope will really influence the health and self-care of our viewers. So thank you.
Thank you, Nancy. Thanks for inviting me. I really am excited to be able to talk about this particular topic.
Thank you. So maybe we should start with heart disease and a review of that so people really understand how this particular aspect of salt in their diet really is an underlying factor to heart disease.
Very good. So let's start there. So heart disease, one of those really generic kind of phrases that can embodies so many different illnesses. In this particular situation, we're talking about high blood pressure, which healthcare professionals call hypertension, which patients sometimes think means that they're stressed, and it has nothing to do, well, not a lot to do with that. So it's high blood pressure and heart failure. Those are the 2 illnesses that really require that you limit the salt in your diet. There are other elements of the diet that are important for heart disease, but this show is just about sodium or salt, and I'll talk a little bit about the difference.
I think that's really important because what we're really going to do is spend this half hour talking with you about salt in your diet. This is very different than just going to your doctor or your nurse practitioner or your treatment team and they say, eliminate salt in your diet. Okay, so that sounds good. That's one of those sound bites that we've probably heard. And even regular people should be avoiding lots of salt in their diet. So it's a good thing for anyone. But what we're going to talk about and really drill into is, how do you do it? And why does it make a difference?
Yes, so let me make a comment about that. Everybody should do it. And actually there's a graphic that we're going to show that is a figure from the Centers for Disease Control and Prevention, from the CDC, that looks at sodium facts and points out that in the United States, we as a general population eat about more than 3 grams, like about close to 3.5 grams of salt per day, of sodium per day, and that's really can be translated into about 1.5 teaspoons of table salt, which is sodium chloride. So it has those 2 components in it. And so sometimes you'll hear people talk about sodium and sometimes you'll hear them talk about salt, but what we're really looking at is trying to get the sodium in the diet down. A lot of people are saying that the general population should be eating about 1.5 grams of sodium diet per day. That's really low. And we'll talk a little bit about how you get from 3.5 down to 1.5, and if that's the right thing for you.
I think that's really good. Now let's translate that again, because I was paying attention and I wasn't sure I really understood that. So you're saying that the average person has about 1.5 teaspoons of salt a day.
Yes.
That doesn't mean that they're like pouring the salt into the teaspoon and eating it. It just has to do with the potato chips. You know, these prepared foods are notorious for being very high in
Bingo.
sodium. Sodium is salt. Salt is sodium. So we got to get our terms, you know, really clear, because not everyone understands that either. But then, if it were recommended, like the recommended amount, what would that look like in a teaspoon?
Oh, wow. Well, that's really interesting. We'd have to just like measure it out, but it certainly would be less than even 1 teaspoon.
So it would be a very
Yes.
small part of that teaspoon, maybe.
And yet for people who have heart failure, we talk about like a 2-gram or a 3-gram sodium diet, which is, 2,000 milligrams, 3,000 milligrams in the diet. And yet for somebody who doesn't have an illness, we want them to eat even less. So there's a lot of confusion that it's making everybody, including healthcare professionals, sort of confused about these issues. And so I think the bottom line is that all of us, whether you have high blood pressure, you have heart failure, you're young and healthy and don't have any of those things yet, although that's, heart disease is the primary cause of death in men and women. And so a lot of us are going to end up in that particular category, but we all probably need to be thinking about the salt in our diets and trying to find a way to just get rid of those really high salt foods, high sodium foods.
I think that's really important. And I think what is also confusing is not just the definition of terms. Like I said, I'm really drilling in that salt is sodium. Sodium is salt.
Salt is sodium chloride. So sodium is a major part of salt. And so you'll hear people go back and forth in those terms.
Right.
But same thing. We're talking about the same thing. Get the salt out of your diet.
Right. But then when you go to those measurements, those units of measurement, grams, milligrams, I think you've lost like 99.9% of the listeners, because people can't visualize. What does that mean?
Let's put that stuff away and let's talk about common sense here. The real issue is that we in America eat a lot of processed foods. And so we buy things that don't taste salty to us, we eat them, and then you wake up in the middle of the night and you wonder why you're thirsty. Well, you're thirsty because you've had too much salt or sodium in your diet. And so there are some real practical ways to just limit a lot of the excess sodium in your diet. And one of them is just eating healthy foods. Just eating, even frozen vegetables are better than canned vegetables, for example.
That's good
because canned vegetables have a lot of salt in them. You can rinse it. You can put a can of spinach and rinse it out in the sink, and you'll get a lot of the salt or sodium out of it, but you won't get it all out. So you're probably a little bit safer eating fresh vegetables if you have access to them. A lot of people don't, or frozen vegetables.
That's really a good point. And I think that the reason that there's more sodium in the canned vegetables is that that is a preservative. That's part of the process of preserving the food in the can. But if you have a reasonable size freezer, and I think that's another thing, people don't realize that the frozen vegetables are really nutritious.
Yes, frozen vegetables are really good for you. And so that's a great way to go. The other graphic that I want to show is a food label, so that we all need to be really good at reading food labels. And so looking at this graphic, what we see here is that the first thing you should pay attention to is in this can of soup or this box that you've just picked up, how many servings are in there, because all of the information on the label relates to one serving. And so you might look at a can of soup and think, oh, that's one serving, and it might say that it's 2.5 servings, for example. And so if it has a lot of sodium per serving, you have to multiply that if you're going to eat the whole thing. You have to say, well, if this is 2 servings, and this is the amount of sodium per 1 serving, I'm actually, if I eat the whole can, I'm eating double that. And so it's that kind of sensible approach to grocery shopping that we all need to use so that we are aware of what we're eating.
So in this label that you're showing us, you know, you're looking at the servings, and then you're looking at the amount of sodium in the portion. So give us a range of the kind of numbers people should be looking for.
Oh, that's really interesting. So our food labels in the United States will tell you how much of your average daily intake of this particular nutrient is contained in this particular food. So if it says 7%, that means that you know, this is a fairly small amount of sodium. But if you are picking up, and I keep picking on this can of soup because they're usually pretty high in sodium. So let's say you pick up a can of soup and it says that it has 2 servings in it, and then you see that it's 20% of your daily sodium intake in 1 serving, and I'm going to eat the whole thing. That's 40% of my daily intake. That means that I can't really eat much of anything that has any sodium in it the rest of the day. And foods just have natural amounts of sodium in them.
Right.
So
doesn't every food practically have
everything
some sodium
has some
in it?
sodium in
Naturally.
it. Naturally, and,
Right.
and it's fine. We need sodium in our diet. So the whole idea is, you know, not getting a surprise where somebody's giving you, oh, surprise, here's 40% of your daily sodium intake buried in this food stuff that you didn't even realize you were eating.
Right. So you're really advocating making some very sensible choices. So if you had a choice between a can of vegetables that you could rinse off before you actually cook them, or you had a frozen vegetable, you would choose the frozen vegetable over the can. If you had somebody, you know, that had a garden, or you had access to a farmer's market, certainly that's the best thing to do because you're buying it fresh, and that only has the natural sodium in it. So we're really talking about 2 excess roots to having too much sodium in your diet is to be eating anything that comes from a can, or even if it isn't in a can, may have other sodium added to it that's part of the preservation of that food.
Yes.
Anything with long shelf lives usually have a lot of sodium in them. The other is adding salt to your diet. Adding it, like sprinkling it on.
I'm not a great believer that that is really going to get us a whole lot of savings in terms of our sodium intake, because food is really not too palatable if it doesn't have any salt in it at all. And I think you're going to suffer a lot, and you're not going to get a whole lot of benefit. Now, I'm not saying pick that salt shaker up and, you know, bury your food in salt, but I'm saying you can actually probably get a lot more gain from reading food labels and cutting the really high salt items, the soy sauce, the things like this out of your diet. And so on the internet, you can easily find a list of foods that are really high in sodium, and really, wow, I'm not going to eat that again. I have a problem with salt. Maybe I have heart failure where I have to limit my salt intake. Maybe I have high blood pressure where I have to limit my salt intake, my sodium intake. I'm not going to eat soy sauce. I'm not going to eat those kinds of potato chips, salted potato chips. But I think you don't get nearly as much gain by not making your food palatable. Because the other issue that I think people don't focus on a lot is that, especially in particular illnesses like heart failure, people are often nutrient deficient. And so here we are saying, all the salt out of your diet, it's going to taste awful, you're not going to want to eat. But by the way, you're really low in folate and thiamine and magnesium, but you're saying I can't eat anything that tastes good, so why should I bother to eat these other things? It doesn't make sense. There's kind of a disconnect here.
So you're saying, from a common sense point of view, to eat a well-balanced diet and sprinkle, you know, just a little pinch of salt on it, because that sort of boosts the flavor for you and makes it more palatable and really more enjoyable. That helps you to eat a normal meal and enjoy it.
Yes.
But to not really, again, use these like top 10 foods, which I wouldn't know what they are. I mean, when you're using a couple examples like soy sauce or canned vegetables or soups, what are some of the other offenders?
a lot of the, certainly the packaged foods.
You said potato chips, and I really
Potato
cringe
chips,
because every
yeah.
once in a while I just love a few potato chips.
And so when you want a few potato chips, first thing you do is you limit them. But if you have an illness like heart failure, you wouldn't eat a lot of potato chips 3 days in a row. That would not be a smart move. So if you have got to have potato chips, I have a friend actually who tells me that she's just got to have a few potato chips every once in a while. She gets out a little bowl, has her potato chips, but then she doesn't have it the day before and doesn't have it the day after. So you kind of have to balance what you're eating over time.
Right. So you have to eat more than one, right? You can't eat just one potato chip, but you don't eat the whole bag.
You don't eat the whole bag.
Except if it's those like little teeny tiny bags that only has a few potato chips in it. But there's like little teeny tiny bags that you get sometimes with a sandwich.
And then you're going to be careful the day before, and you're going to be
right.
in the rest of the day, etc. Something else I really want to talk about though is eating out, dining out.
That's a good one.
Because that is a place where all of us feel uncomfortable. I know that I do really poorly if there's a lot of fat in food that I'm eating. And so often I'll go to a restaurant and I'll say, oh, is that a cream sauce? And if the waiter says to me, oh, that's not a cream sauce, then I'll order it. And sometimes it just has, a half a pound of butter in it, and it makes me sick to my stomach. And so we all of us, myself, I'm really owning this one, need to be a little bit more assertive by saying something to a waiter like, can you put the sauce on the side?
Right.
Or I've really been trying to follow a low salt diet. And so would you ask the chef to not add any extra salt to my meal? I mean, these are hard things to say.
Right. Well, we're not used to it, and I think that's part of what this show is all about, Dr. Nancy RN, is really to give you those prompts so that you feel more comfortable saying it, because after all, it is your health. When you go out to dinner, you don't want to necessarily be directing the chef to do 5 different things in order to have your custom meal, but you could ask for sauce on the side or dressing on the side, or please do not add extra salt, or then to be more discriminating as you're reading down the menu. But a lot of folks, they don't necessarily go to fancy restaurants with chefs. How about fast foods? Most people are eating in fast food restaurants.
Oh, that's a great point. And a lot of the fast food restaurants today actually will have a sign that will tell you how much, it's reading labels again, how much salt is in here, how much fat is in this particular meal. In some restaurants that you go to, there'll be a heart-healthy option, and that's probably not the best option because that means it's low in fat, and they might have compensated for the fat by putting a whole lot of salt in it. And so again, you need to be able to read that label. And I didn't answer your question before. I sort of got off on the restaurant, but I really wanted to come back to what are some of those other hidden sources. So in your spice drawer, when you see things that say garlic salt, something or other salt, those are things that have a whole lot of sodium in it. There are a lot of medicines not a lot, but there are some medicines like any of those fizzing medicines that actually have a lot of salt or sodium in there. So you want to read the label looking for these words: sodium, salt, soda. All of those things have sodium in it. So you want to be reading labels. If you have no other take-home message from this particular program, learn to read labels.
But what we're trying to do is not only prompt you to read them, but to understand what they say. Now, you said soda. Are you talking about regular soda as well?
No, baking soda, those kinds of things.
Right.
And you'll see on something like a lot of breads actually are fairly high in sodium or salt because salt has been added or some sort of a baking soda has been added. And so,
interesting.
Yeah.
So is that a big offender, the bread? Or
bread
again,
actually can be really high as an offender, but on the other hand, for a lot of the vitamin and nutrient deficiencies of at least older adults with heart failure, those grains that are in breads are really very good for you.
Right. Well, let's stop right there because I think that's what a lot of people say. They get confused. They're like, well, you know, the experts are telling me to do this, but then they're also saying out of the other side of their mouth, like, do that. So let's use the bread example. If someone was going shopping and they had heart disease, or again, they were just really more vigilant about their sodium intake, you know, irrespective of any disease, would they sort of go down the bread aisle and look at different breads and read the labels? And if so, are there any particular breads that you would sort of steer them in that direction? You know, like multi-grain bread, or
Yes.
I don't think white bread's a good idea for a lot of reasons.
For a
They
lot
don't
of
have well,
reasons.
they don't have a lot of nutrients in
No.
them.
So I'm of the philosophy that life is a balance. And so I want to cut down in the unhealthy arena, and I want to not just, you know, cut down on things, or else you can spend your life cutting down. I want to put more energy into those areas that are really, I'm going to get something out of it.
Right.
So I'm walking down the bread aisle in the grocery store and I'm reading labels. I'm practicing reading those labels, and I'm seeing that I have 2 breads that have, each one has 7% of my daily sodium intake in one helping, which is 1 slice of this bread. This one is a white bread. This one is a multi-grain bread. If I look at the other components that are on that label, I see that this white bread has sodium in it, and it'll have a carbohydrate component in it, maybe a little bit of fat. But this one actually has some vitamins and minerals in it, and that's what I want.
Right.
I want to eat bread. It's part of life. It's a good part of life. I like bread, but I want to eat a bread that is fairly low in sodium and gives me all those other nutrients.
Right. Which is really good for any kind of food selection. You really want to make a selection of a food that's really going to give you the most, you know, important nutrients and is also going to taste good. So let's go to heart disease, because we really want to understand, if we go through all this label reading, and it's a good thing, you know, children should be learning how to read labels, so when they become adults, they don't even have heart disease, hopefully.
Please.
Yes, wouldn't that be wonderful? I mean, that's really the goal of
Oh,
prevention.
Mama.
Is really to start, you know, at a
Please
young.
teach them when they're young.
Right, teach them about a lot of things when they're young. But with heart disease, tell us why this is so critical in terms of self-care and self-management, having to do with fluid retention and monitoring that.
Yeah, so let's go to this particular example of heart failure, which is a syndrome in which the heart is not pumping effectively. And so it's not pumping well, and so it's struggling. And so what are we going to do? We're going to give it a high salt diet so that it has more to struggle with? That doesn't make any sense. And so that's the whole reason to avoid or cut down on salt in the diet when you have heart failure, because the heart is already struggling and we don't want it to struggle more. And so we want to not overwhelm it with too much fluid to pump around.
Well, explain the link for some people that really are not into
You're
chemistry.
right. I didn't say that.
That don't understand
Thank
if you have salt, what that does to the
Thank
water
you.
that you're drinking or the water that's in the rest of the food that you're eating.
Thank you. And you're totally correct. It makes you retain water. And so that's why if you eat a really very heavily salted meal, and then you wake up in the middle of the night and you're thirsty, your body is trying to get you to equilibrate the amount of salt that you have in your system and dilute it with some more water.
Right.
And so salt retains water, and that's the basic of what's happening then. And so then your kidneys don't excrete it, and you have more for your heart to pump. And that's the problem with heart failure.
So it does put a lot of extra burden on your heart. And one of the ways that you can really tell if you're retaining fluid is if you have any kind of illness such as heart disease. You're encouraged to weigh yourself every day at the same time with the same scale and keep a record of your weight so that you know what your baseline is. And if you gain even a couple pounds, that is serious. And you really have to look at not just your diet, but you may want to call your healthcare provider and get some advice on that. The other is
So let me just interject. You said heart disease, but it's really heart failure.
Heart failure,
Yeah,
yes.
that is really the issue in terms of weighing yourself every day, because it's in that particular final common pathway of the various heart diseases that the heart then becomes not as effective pumping and then retains fluid, and that's when you want to weigh yourself
Right.
every day. Very
Right.
good.
But I think that's a very good clarification, and thank you for that. I think the other is you were showing us a graphic. I think we can put that in to show folks that maybe your ankles are swollen. You know, your
Yes.
shoes are tighter, or maybe you say, you know, your jewelry could be tighter on your wrist or on your fingers if you know, your wedding band is tighter.
Yeah, exactly.
So I think that these are all cardinal signs, but your heart is telling you indirectly that it has too much fluid, and some of that's got to get flushed out. So, I mean, people could see that they're creeping up a tiny bit, even a pound or two. They would then even be more vigilant about their diet. But what else would you recommend they do?
So what you're really alluding to is this whole process of self-care that we've put decades now of work into trying to figure out how to engage people in self-care. And part of it is what we always refer to as treatment adherence, which is sort of a boring term of, you know, please take your medicines, please follow a low salt diet, please do those things that we think are actually going to help you. But I think what's really even more important is that real engagement, not just in doing the things sort of routinely, but that real engagement in the process of paying attention to your body, that body listening. So you're actually checking your rings, you're checking your symptoms, you're checking your body weight, you're checking your blood pressure if you have high blood pressure, you're checking your blood glucose if you have diabetes. That real engagement in paying attention to what your body is telling you, so that when you see a little bit of a change, you can then call your nurse practitioner, call the nurse in the office, call the physician, and say, I'm seeing a change. I think something's going on here.
Right, right. See, Dr. Barbara Riegel is an expert in this area, and I think that what she's telling us is that this is really, for some people, a big switch, a big adjustment, because many people are zooming through their lives at such a rapid pace, they're not even paying attention. They're not listening. They're not paying any attention. They just sort of assume their body is going to take care of itself. But that is really not the reality. The reality is it will take as good as care as you help your body to do. And this body listening concept, I think, is terrific, because it is that self-awareness. Your doctor, your treatment team can't do it for you. You really do have to engage. That's this new buzzword in healthcare reform, is patient engagement. And patient engagement is listening to your body and following through on the treatment regime. You know, because it's sometimes frustrating for the treatment team when you don't do that, they tend to label you as treatment resistant, or you're just, you know, really not complying with the treatment. Part of it is that people really didn't understand do not understand the terminology, do not understand exactly what they're supposed to do. That's why we spent so much time with you today drilling into this, you know, about reading labels. Most people don't read labels, but we really have to do it. Most people are not listening to their bodies every day, but you know what? We really have to really change that orientation. And as we said, you know, moms and dads have to help their children to do that. Really, you know, again, help them to tell you what is, you know, what they're feeling, or if they have a problem, whatever the illness may be. Because that way, we will be able to take the steps that are really necessary in order to avoid any kind of problem. Prevention is the key to healthcare, and certainly to healthcare reform. It's really to change that focus from illness care to health care. And I think that as we're talking today, Barbara, I mean, I've learned and I've been more sensitized. I would be the first one to admit I'm not necessarily running out and reading all these labels, but I think I am definitely inspired.
Oh, good.
Yes, I think I'll definitely be reading more labels.
Wonderful,
I mean,
wonderful.
I think that it is something where you know, like potato chips aren't good, and I know about soy sauce, and I know about ketchup and prepared foods. But you know what? I wasn't doing that sort of, differentiation between one food product, in this case we use the example of bread, and really using that as the test about what I was going to choose. So I think that, you know, we all can improve in these areas. And I want to thank you, because today I think we did cover our points, and that is, you know, why do I need to avoid salt? And then secondly, where is it? You know, how can I become a salt detective? And then how I can limit it, but not eliminate it. And like you said, everything's a balance, and still enjoy life.
Yes, and make changes slowly.
Right.
Yeah, so you can stick with it.
Good. Well, thank you, Barbara. This has been very informative, and I want to thank you all for joining us today. And hopefully you will be the salt detective for you and your family and others, and have a wonderful life. I hope you enjoyed our conversation today, and that the information will help you in meeting your health goals. Catch this program and other conversations on the website, drnancyrn.com. Or you can write to me as well. I welcome your comments and feedback. Thank you for listening, and join us again. And remember, with health, all things are possible.